The question, the member from Newmarket, Aurora.
Thank you, Speaker. My question is to the Minister of Health, and I want to ask the Minister about her decision to ration personal support services for Ontario seniors. Speaker, when the Minister announced the government's assisted living for high-risk seniors policy, what the Minister did not tell us is that up to 80% of current applicants would receive no benefits under the current rules. She also didn't tell us that seniors who are now getting essential services on site in their seniors' buildings would be cut from those services. Here's an email, Speaker, many of which my colleagues, and I'm sure hers, are getting from across the province. It reads as follows. The seniors are devastated because they recently found out that the province is defunding the Alternative Community Living Program. And chats will not be available 7 days a week, 24 hours a day.
Question.
The question is, from this constituent, how is it possible to have these disabled seniors lose their services?
Thank you.
Speaker, I'd like her to answer.
Minister of Health and Long-Term Care.
Thank you, Speaker, and I'm delighted to talk about how we are strengthening the home care sector and the community care sector. In fact, this is our single most important priority, Speaker, and our money is where our mouth is on this one. In the last budget, we increased community and home care support by 6%. We were able to achieve that only by holding steady on a number of other elements of our health care system. Speaker, as a result of our investments, 200,000 more seniors are getting the care they need in their home, in their community. Speaker, the home care sector is an increasingly important part of our health care system as we shift services to the community where people get the care they need in the place with the highest quality for them, and that is in their home whenever possible. We are expanding services in the community, Speaker.
Thank you. Supplementary.
Speaker, that rhetoric is not going to go over with the seniors in this province who are losing their services. In a memorandum dated June 19, 2013, the Community and Health Services Department of York Region announced that the new Ministry of Health policy would have serious implications to seniors in York Region. Not only would the level of personal support services be reduced, but according to that memo, it warned that more than 80% of current applicants would not receive any services. The minister said the money is where the mouth is. I'll tell you where their money is. It's in scandals. It's in e-health, lost precious millions. It is in gas plant losses. It is in her track record of not giving precious medications and prescriptions to people who need them most. It is in her lack of oversight at Orange.
Question.
That's where the money is. And that's why they're now rationing services for seniors in this province. I want to know from the minister, will she rescind that policy today?
Thank you. Be seated, please. Be seated, please. Thank you. Minister.
Well, Speaker, I think it's important that the member opposite actually hear the facts about what is happening. And I will be the first to say, Speaker, that we are changing how we are delivering care in this province, and we are changing it for the better. CCACs help over 650,000 people get the care they need in the community. That is 200,000 more people than when you were in office, Speaker. We've increased the number of patients who are going home after a hospital visit by 26%. These are people who otherwise would have been destined for long-term care. They're getting more supports in their home where they can live with a high quality of life, Speaker, where they want to be. Over the past 2 years alone, we've increased the number of people receiving home care services by 76,000, and we are continuing to expand, Speaker. In order to do that, we need our PSWs working in home care, and we have plans for that as well.
Question.